Well, hello again. Thank you for tuning in. This is Laura with More Injury Funding. I'm your host for It's Time for More Injury Funding podcast. I am a sponsor, member, associate, or business partner of Academy of Truck Accident Attorneys, Sandy Springs Bar Association, Georgia Association of Paralegals, State Bar of Georgia, and Georgia Hispanic Chamber of Commerce. In today's episode, I have a very special guest, my dear friend, functional medicine, Dr. Sonza Curtis, founder and CEO of 3DWellness. Welcome, Sonza. So good to see you.
Nice to see you, and thanks for having me.
Absolutely. I'm so used to calling my dear former neighbor here in Roswell, Georgia, Sonza by first name, but she's so. Tell me a little bit about yourself. How did you get to where you are today?
Well, it's interesting. It all started actually as a young girl, and I had no idea. My grandmother was an herbalist and a midwife. And we grew up with herbs. That was the common thing. It's like, take an herb for that, take an herb for that. My dad was in the military. So, we traveled everywhere. And when you went to the military hospital, you didn't want to say because it would take you hours and hours. So we really relied on my grandmother's remedies at that point. And it wasn't until my grandmother got of age where she got Medicare and she had medical insurance. And she just got so sick. And we couldn't really figure out what was wrong with her. And now that I look back, I realized it was an autoimmune disorder. She got probably had Hashimoto's. She had thyroid eye disease.
Okay.
And that's where your eyes protrude out. And one day we had a joke that we said that her eyes popped out of her head. But it wasn't that just her eyes, the pressure was so high. And I remember as a kid that I would go, she had a cabinet right by her bed when she was ill. And it was a shoebox, and I literally would take her shoebox full of medicine that they had given her because I couldn't figure out what was wrong with her. And then by the time before she died, I can remember it had progressed to 2 shoeboxes. And at that point, I said, this has to be a better way. So initially I wanted to become a medical tech. I'm working in the lab, and life was lifing, and I got pregnant, and then I got married, and then I moved to Germany, and then I got divorced. And then that's when it came full circle where I went back to school, started off in nursing. I'm like, no, this isn't it. And then I went to be a PA. Took me several tries. So I understand that getting in, it's not just like one and done. But once I got into PA school and I did that, it was amazing. And then all of a sudden I just got tired of getting a pill for you. People were coming in, they didn't want to take responsibility for their health, and I said there has to be a better way. So then I started studying natural medicine. I went back to school to be a naturopath. That's where hence the doctor comes in. So I'm a doctor of naturopathic medicine. And at that point, that's when it really clicked, Laura. It clicked like, this is what my grandmother was talking about. And then I found my purpose, and I'm like, this is what I was born and meant to do. And I love taking care of people. I love taking care of patients. And then I had a preceptor, Dr. Christine Gustafson. She was one of the pioneers in functional medicine in the Atlanta area. And I went to mentor her, and she was my mentor. And I went in to shadow her. And I was there almost 12 years. And I was there when she passed. And she introduced me to functional medicine.
I had no idea. I remember you talking about her for quite a while years ago. She did. I'm so sorry.
Yeah, she passed. Well, she actually passed before in 2012.
Okay.
And then Dr. Betsy Board bought the practice, and then I went in to help her. And then after doing that, I'm like, I just need to be me. And that's when I started 3DWellness.
I love it. Absolutely. Normally on my podcast, we talk about attorneys because, as you know, I own More Injury Funding, the legal funding company. And so this podcast is really to bring, people in the community to help each other. Of course, the attorneys, doctors like yourself, any other practitioner related to law, and I just want to bring the awareness to the clients and spread the word about your practice and how important you are in our lives. And so, of course, primarily I talk about personal injury, workers' compensation, or related law advocates, and we often talk. The nerdy talk and go into detail and specifics in law, but we often forget to talk about lawyers themselves and how stressful, demanding, and sometimes debilitating physically, mentally, and emotionally this job can be. So today I want to talk specifically about the well-being of not just personal injury or workers' compensation attorneys. I want to talk about the physical well-being of all lawyers and all other really people, any profession nationwide and worldwide. So today, Dr. Curtis, we'll talk about somewhat unconventional type of medicine, or medicine called functional or preventative medicine. Dr. Sonza will explain how functional medicine works, its similarities and differences from the traditional medicine, and how it can apply to attorneys' lives, or anybody else's lives, of course, me including. Finally, I have a pop-up question for you, Dr. Sonza. So stay tuned in. And my dear listeners and viewers, you are here for the treat today. So Sonza, please tell us you had mentioned, how did you become a functional medicine would? Scratch that, we already talked about it. Tell me, please, how would you describe functional medicine versus traditional medicine? What are the main differences?
Functional medicine focuses on systems and structure and the root cause of what's giving the issue to begin with. And the regular medicine focuses on the symptoms, the IDC-9, how they get reimbursed. And when you go to a heart doctor, they're only going to look at your heart. We are in functional medicine, we're going to look at what are the contributing factors to your cardiovascular breakdown. If it's blood flow, is it because of inflammation? Those things of that nature. So it's really interesting how the matrix kind of goes, because I look at from a patient, I look at them from birth to current, because I want to see what are some of the triggers, what has triggered them. We always think, well, on May 25th, that's when my health went to, can I say hell in a handbasket?
Of course.
Okay. So
I'll have to turn on the explicit content this time.
The matter is, it started brewing, even from the time, if you were born a C-section, then you get your microbiome from your mom. Mm-hmm. So if your gut is already at a disadvantage, and I know all my lawyers out there like to play golf. So if you have a handicap, then you have a handicap when it comes to your healing journey. And then you add, different entities on there. You add a lot of antibiotics, you add stress. Well, if you go to law school, that's stress. As a lawyer, that's stress, and you have these issues and litigations, and it's stress. And also what I find, I have a lot of my patients are also lawyers, and when they come in, it's just like the physician. You sit there and there's no way you can sit there and listen to or see a person go through or evolve into this real catastrophic issue, mm-hmm. and you don't take it home with you. It's so hard. We want to say we turn it off, but it's not when you see that something really bad happened to good people. So it's just trying to get that stress, managing your stress, making sure we're eating correctly. Mm-hmm. Because, come on, what do we do? When you don't have you don't sleep very well and you're stressed, this is very common. It's
not pointing fingers at anybody.
Yes, we do that hand to mouth, and we really don't think about it, And sometimes it's okay, and that's the thing. We're not made to be perfect, and there's no perfect human being. And if you think you're perfect, I'm sorry for that.
I love it. So, Dr. Sonza, can you tell, are there certain advantages in one types of medicine versus the other? One would take the functional preventative medicine versus the traditional medicine. And what about disadvantages of each other?
Well, the beauty of it is I married. So they got married.
Mm-hmm.
The conventional medicine married the Western medicine. And that's really what functional medicine is about. It's not the fact that we're going to give you an herb for everything. If you come in and you have, your blood pressure's sky high and your glucose is sky high, there's not an herb for that, right? There's an herb that can help you with chronic disease. So the American conventional medicine system is great for acute care.
Mm-hmm.
Where it falters is in management of chronic care.
Mm-hmm.
And that's where functional medicine comes in. If you're having a heart attack, kind of go to the hospital. Do not come to my office, okay?
ER, emergency room.
Emergency room.
911.
Call 911. But if you're taking blood pressure and you're trying to get it down, they're telling you have to take medication after medication. The one thing about functional medicine, I'm going to look to the root cause, like what's really causing that issue. And you'd be amazed at some of the things. It could be something simple as sleep apnea.
Mm-hmm.
You're not sleeping well. You're taking medications that's depleting of your nutrients that's causing more issues. So there is really no good or bad. It's just how to use one appropriately and when to even intermingle the two.
Mm-hmm.
That's really it. And I'm fascinating in 2023 that a lot of times my patients are coming to me and they're like, my doctor told me to go off gluten and dairy. And I'm like, who's your doctor? Because now people are becoming more aware of what we eat in the medical field does affect you. Now, to their defense, we get no nutrition. None. Or I'm sorry, just a little bit. Okay. But nothing to really understand the microbiology and how that affects your function, right? So that's to their defense. I mean, I go see a regular doctor, and it's not them against us.
Sure.
It's really just trying to combine. I have tons of doctor friends that are in the conventional world, and I refer them out. And I know that when they get my patients, they don't feel like, oh my God, she's a quack. They totally understand because it truly takes a village to heal our community.
So true. And it's interesting you say that because I remember I worked with you doing a phlebotomy. I remember I had a couple patients and you were so kind, just let me, just work, for a few months while I was applying to physician assistant school. And since then, it's been about 12, 13 years, more or less, maybe even more. How much that had changed, functional medicine. Now it's a totally accepted normal term that, hopefully, most people are familiar with. And it's interesting, Dr. Curtis, you had mentioned, you talked, a couple key words here, nutrition and chronic diseases. Can you tell me, as a functional medicine advocate, how do you see the role of nutrition and lifestyle factors in preventing and treating chronic diseases?
That is the pinnacle right there, nutrition and lifestyle. We all I always tell patients when they think about nutrition and think about diet. What are the first three letters in diet? Die, right? So when you think about a diet, you also think about when am I going to start and when am I going to end? But lifestyle is a continuum and it gives you the tools. So lifestyle medicine gives you the tools to have the ebbs and flows. If you have an anniversary, don't sit up there and tell your spouse, I can't eat the cake. You may be okay to eat the cake if you don't have celiac or if you don't have a severe autoimmune disorder. So it's learning how your body works and learning yourself, listening to your body is the key. I know if I eat certain gluten, I'm going to have muscle aches. So it's almost like that thing that you say, doctor, it hurts when I do that. And he said, what should I do? And I'm going to tell you, don't do it, right? So it's just that simple. And we want to make it so complicated, but it really isn't. And so just eating whole foods, and honestly, our diet and our food, agriculture, food industry has also evolved, and we've put a lot of, different additives, GMOs, a lot of processed food. I always tell my patients, if you eat out of a bag in a box, you're going to end up in a bag in a box. Okay. So it's really just eating whole foods, good quality food, and eating from the ground, and making sure that whatever type of meat that you're eating is not pumped up of antibiotics and steroids and all those things. Grass-fed is better. And when you think about it, we eat the season. If we eat what's in season, body doesn't have as much inflammation because you're not fighting what's not out of season.
Where would you recommend shopping? Just a quick question. We live in Georgia, so probably we're more familiar with the state of Georgia. Besides Whole Foods, is there any other store that you would recommend people go into to shop for healthy foods?
You can go to Publix. You can go to Kroger. Believe it or not, you can even go to Walmart.
Okay.
Yeah.
Okay. I need to revisit there. It's been a while.
You're going to go to Walmart. The key is reading the labels. I always tell, if you have to take a phonics class to read the ingredients on your food, if you have to go monosodium, that's not. Scratch it, okay? If it's got apples, lemon, pepper, things that you can read and you can identify, and it has probably about, I'd say anywhere from, I'll give you 10 ingredients or less, then it's good. And look at the sugar content. One of the things with the ingredients, people say, oh, Dr. Curtis, I can't eat sugar. Where's the sugar source coming from? If the sugar source is coming from fruit, it's fine. But the ingredients actually tells you, like if sugar is like the number 1 or 2, then that's an added sugar, then that's where it's coming from. But if it's on the latter end, then it's less sugar. I prefer no sugar, but I know everybody's not like me, so I have to meet people where they're at. But reading the labels is key, and knowing what you put in your body. And I always ask people, if you bought a Porsche, would you put cheap gas in your Porsche? Well, you are a Porsche. So put good quality food. And when you pay for that food, that good quality food, I can eat as much of it, I'll tell you, because it's expensive.
Sure. I love it.
But you can, bone broth and different things of that nature. But you can go to Aldi's, Trader Joe's. Those are some other great places that you can shop. And people think I have to go to Whole Paycheck. But Whole Paycheck has changed since Amazon has taken over.
True.
Yeah. So it's not so healthy. So a lot of times I go to Fresh Market and I'll go to Sprouts. That's another place. And I tell you, the sleeping giant that nobody wants to, that's out there, it's Farmers Market. Every Saturday morning, I'm at the Alpharetta Farmers Market if I'm in Alpharetta. Okay, maybe I exaggerate, maybe not every, but pretty much almost there. My family will call me. Did you go to the farmer's market today? Did you go to the farmer's market on Saturday? So it's local. It's not expensive. And they even have meat. They have all different things. And it's also community. And you're helping your community.
That's the most beautiful thing. Yes. It's interesting you talk about markets, because I grew up, from being from Lithuania, North Europe. We literally grew up shopping in markets because it was less expensive, healthier, and we knew those people. And, plus we could haggle. So me and my mom would haggle. My dad would be so embarrassed. He just would walk away. He would pay full price. He's like, here you go. But me and my mom was like, okay, if it's $1, can we get for 75 cents or maybe, 65 cents? So yes, interesting. Can you provide examples of how functional medicine approaches the root causes of health issues rather than just treating symptoms?
Well, one particular case I can remember was a young lady. She came in, she had an autoimmune disorder where her hair was coming out, and a plug-in for autoimmune disorders. So she came in, and to be quite honest with you, I didn't think I could really help her, honestly. But I was like, okay, well, what do I do? I know functional medicine. So that's what I did. So I applied all the functional medicine principles, We worked on healing her gut because the gut is the first sign of inflammation. Hippocrates said, "Let thy food be thy medicine, but also let thy medicine be thy food." And I take it a little step further, and I said, "Or your food can be your poison." So that can be the root cause of some of her issues. So we worked with her. We did a gut reset program. We removed we exchanged certain food groups like gluten, dairy, and sugar, put her on some digestive enzymes to kind of help her digest. And in the interim, we also did some blood work. And that's the other difference between functional medicine and natural medicine, and regular medicine, because we look at different parameters, and they, like, for instance, like the thyroid is the range is 0.45 to 4.5, 0.45 to 4.5. That's like walking into Macy's and saying, "Can I have a normal woman's shoe?" What's that? 7, 8, 9? It all depends, right? So that's a huge range. So we look at it from a tighter range, from a functional. So we have functional parameters versus the regular parameters. So I ordered an in-depth labs on her. We found that she had some pretty nutrient deficiencies. Also gave her some other, and it was a prescribed medicine that I gave her, was low dose naltrexone.
Okay.
And so gave me some topical. I work with my compound pharmacy. You don't have to know everything. So a good functional medicine doctor is as good as the good compound pharmacist. So I called my pharmacist and I said, "Hey, I need to get out of jail. I need an SOS. I really want to help this young lady." And so they gave me the formula, and she applied it. And she called me about 3 months later, Laura, and she says, "Dr. Curtis, my hair's growing back." And I thought, "Yeah, wow. Okay, whatever." And so she said, "No, seriously, it is." And I saw her 6 months later. Oh my God. When I tell you her hair was bald with patches and red at the top. She had hair on the side. And now her hair's, you can't even tell.
Oh my goodness.
No patches anywhere.
So any of my clients that love being bald but would like to see themselves with hair, we'll talk about contacting Dr. Sonza Curtis in just a minute.
But that's not autoimmune. So it all depends. There's multiple types of autoimmune. That was just one of the cases that really was like, it was so fascinating. Like, I was even blown away with the power of functional medicine as a practitioner. And it's that way all the time. The difference also is I partner with my patient. I don't say, "Go do this, you do this, you do that." I find them and I meet them where they're at, and then I bring them up. So we compromise. So like, "Doctors, I'm giving them my gluten right now. Okay, let's cut it back a little bit. Let's cut out the sodas. Let's cut out this. Let's cut out this first." And then when you start feeling better, you want to do better.
Absolutely.
Right? And you got that trust factor. So it's amazing that I've even seen things that turn around as a practitioner, and that's what I love. When I was doing regular medicine, it's like, "All right, the script. Oh, your blood pressure is fine. Oh, this is fine. Okay, you're looking good. You lost a few pounds. Yes, great. But now I need to give you this other medication because now you got another problem." So I love seeing the fact that I can take people off their medications, and when they see the joy, it just brings joy to me. And this young lady that we're talking about, she was a teacher. And you know what she did? She's changing her career to become a nutritionist because of her experience.
Aww.
So that's when you know you've impacted and you're doing what you're supposed to be doing, because I impacted not only her, but now she's going to impact how many people is she going to heal and help.
It's amazing. And just so you know, Dr. Curtis, my former neighbor for many, many years, is one of the kindest people, always positive, encouraging, with her smile on the face, no matter what she's going through. Now with her practice, have worked in the traditional medicine setting and then functional medicine setting, which are different in a way. She always managed to be that encouraging, like sister, mom, grandmother, and she actually plays all of those roles, and the wife. And just a fabulous, fabulous woman, just good vibe. Let's put it this way. So Dr. Curtis, there's still a lot of controversy about the functional or preventative medicine in our communities and the site overall. Even though we are familiar with the term, we feel much more comfortable in the last 10, 12 years or so. But what are some common misconceptions or criticism about functional medicine, and how would you address them?
Well, I'm going to go back and say thank you, Miss Laura. But yes, you are just the sweetest kind. So like attracts like. So we connected with each other at the bus stop, and her son and my grandson.
Many years ago.
Yes. One of the big myths, to go back to your question, one of the big myths that was going around is this quackery.
Mm-hmm.
They're just giving you all these supplements. And I think from a patient point of view, they listen to a podcast and vitamin D, and I'll just take it. You haven't checked your lab and you haven't checked your level, and more is better. And there's no drug-drug interaction. There's no drug-herb interaction. There's no herb-herb interaction.
Mm-hmm.
There's no homeopathic interaction. And I'm going to take more.
Mm-hmm.
And then sometimes I'll get patients and they listen to this podcast, and this has magnesium, and this has magnesium, this has magnesium, and now they're symptomatic because they have too much magnesium. Ooh. And then they're like, well, and you have to curtail that back. And they're like, well, there's nobody there overseeing what they're doing.
Mm-hmm.
And so I always tell my patients, it's like making sure that you truly understand. And when you're picking a functional medicine doctor now, when I first started out, it was very rare.
Mm-hmm.
Now everybody has picked up a book. You don't know the degree of that they're training. So you want to check the ifm.org. Those are people that are actually gone through the certification.
Say that name once again, please.
ifm.org.
Okay.
And there's, functional medicine people throughout the world that's on that platform. And the other thing is, when you go to a functional medicine doctor, you can expect to take, it does cost because we spend a great deal of time with our patients, but it should not be a mortgage payment. Okay, that's the other thing.
And one thing you probably don't, doctor, remember at all, but I do. I remember after having my son, he was a toddler at that time, maybe 2.5 years old, more or less, and maybe a little bit older. But I had these like, I don't know how you call it, like bumps on the back of my arms, on the upper arm. Mm-hmm. And they were just not, it didn't look good. I was cautious about it, or aware rather. Probably nobody else noticed, but I knew because I just never had them before. But, and I remember, you just touched my skin and you said, you know what, just try to cut out. I'm trying to remember now, it's been a while. Gluten and wheat and sugar, gluten and wheat, I think it was, or one of them. And literally within 2 weeks, it was gone. Knock on wood, it's still gone. So many years later. Thank you.
And that's the power of the diet, right?
That's amazing.
The power of the change in what we put in the product.
Quick question. Since again, I work with attorneys, personal injury attorneys, which is one of the most stressful practices in law in the United States. There is quite a bit of parties, events, seminars, different community events, which are constant. And so attorneys are involved in all these, events, promoting themselves, helping out communities. And there is quite a bit of drinking. So if somebody is not ready yet to quit drinking alcohol, are there any substitutes, or is one alcohol better than the other, in your opinion?
Yeah, that's a loaded question, Laura. Well, the bottom line is alcohol and sugar.
Mm-hmm.
Also, red wine gives you resveratrol. So resveratrol is supposed to be the fountain of youth, right?
Okay.
But understanding that it takes your liver 1 hour to detox 1 ounce of alcohol.
Okay.
So that's another thing. So drinking slowly.
Okay.
Slower will help. There are different types of there's wine that's out there, dry farm wine, because again, we go back to the agriculture.
Okay.
So the grapes, if they're full of GMOs and all that, you're ingesting those as well. So Dry Farm wine is a keto wine, and you have a subscription for that. So I know the lawyers and attorneys, you can afford that. I get it like every 3 or 4 months, and you can get 6 bottles, and it's low keto, ladies. So you don't have to worry about all of the pounds there, but it also tastes good.
It's amazing.
It tastes good. The other thing sometimes I'll have my clients do, sometimes people don't need to know what you're doing. Put some sparkling water with a berry on top or an umbrella in between there to kind of stretch that out. So it looks like you're keeping up with the Joneses per se, but you're really not. And you're giving your liver that time to detox. And there's tequila out there that's in potato alcohol. But tequila is made from agave.
Okay.
And so I think Kevin Hart has one that's brand from Carnier.
Okay.
I think it's supposed to be like plain. I'm not really a person of that consumption, so sorry for that, guys. But I do know the wine. So that was the wine I do know. There's also gluten-free beer. So people think like, oh my God, I can never do beer again because beer is gluten, but there's gluten-free beer.
Okay.
And there's a other adaptogenic type that has the different herbs in there. I can't think of the name on the top of my head, but I don't like them. I just rather do without. But sometimes some people do like them, so they kind of mimic the alcohol. And I think they have a place in Atlanta. I don't know the name of it. I think it's Social Circle. Where they actually sell. It's a place where if you're in recovery or you just don't drink, you can get mocktails. You get the greatest mocktails, and they actually have non-alcoholic spirits. So they have non-alcoholic gin, non-alcoholic bourbon, and you can buy that at Total Wines. And
we can maybe I'll Google that, and maybe Doctor, we can meet there next time for our social hour. So how do you incorporate personalized medicine and individualized treatment plans into your practice at 3DWellness?
Well, I treat the whole of person because if you're stressed out and you're attorney and you just have all this stuff going on, and you also have high blood pressure and diabetes, and you have sleep apnea, I'm going to treat the whole person. So a lot of times I recommend, if there's family stuff going on, sometimes I'll recommend counseling. Because a lot of us, whether we realize it or not, we have the ACEs. They did a study not long ago. I mean, it was quite a while ago in California, on Kaiser Permanente, and it was adverse childhood events. So the people that had 2 or more of that was considered to have more susceptible to disease later on as they move up. And so we all had some type of childhood events.
Sure.
Whether we realize it or not, we've all had some, and some more traumatic than others. People have gone through a lot of things. So what do we do in life? We try to pack it up, walk around. How are you? I'm fine. Are you? I'm okay. Are you okay? I'm okay. And the truth of the matter is we're not. And so dealing with the root cause of the emotions are always moving, right? So we have to try to stop and be still and take that time to be one-on-one and really get to know our body. One of the things I talk about people with stress, when you were a kid, you had butterflies, right? As an adult, we just kind of push those things back. We don't even deal with it. Like, I got a test, I feel sick, those type of things.
Boom, boom, boom.
Yeah, I mean, it was like me. I had a young lady, I hired her, she quit. My car went on the flame. I had to rent a car. I had 3 rental cars in 2 months. My computer was going out, so when life doesn't happen like, okay, we're just going to happen, let you digest that. And so when life is coming at you that way, sometimes you just have to be and not do and just be still. So I have my patients do this quick little thing where it's 5 minutes in the morning. 3 things you're grateful for and why. And I do this myself. 5 minutes in the evening, 3 things that you're grateful for and why. The act of gratitude alone increases dopamine production in the brain. I'm going to say that again. The act of gratitude alone increases the dopamine production in the brain. So the dopamine is that feel-good neurotransmitter, that high that you get, right? And then it also decreases inflammation down to the cellular level. So if you want to work on decreasing inflammation, people come, I'm so inflamed, so inflamed. And you're like, I'm inflamed watching you. You know, it's fire, it's fire, right?
Okay.
So you sense that somebody's on fire, you can catch fire, right?
Mm-hmm.
So you just need to stop and be. And I think so much we focus on the body, but it's the mind, the body, and the spirit. And that's how I incorporate personalized medicine, because it depends on you, what you're going through. It doesn't make your disease. I'm not treating your disease. I'm treating you as a person in the state that you are currently.
Okay. And talking about gratitude and taking that moment, if I may, Doctor, I would like to say thank you so much for finding time for us today to chat and talk about this very important topic. I know your life is very busy, and just finding, that half an hour, I truly appreciate it. Another thing is I want to just thank God for everything that happens in my life and Dr. Sonza Curtis' life, and truly appreciating everything, good and bad things, and just and third thing, I'm appreciating that I'm alive and can smile and be here and learn. What about yourself? What would you like to say thank you for today?
Well, I mean, thank you for those people that are listening to it, that are going to listen to me. I appreciate that. I also appreciate just waking up this morning, because a lot of people didn't even have that opportunity. And I appreciate and grateful for people like Laura that's trying to get the message out there. But not only that, she's truly a good person from the inside out, and she really wants to get the information out there. I remember when Laura came and I first met her, and she was telling me, we were talking at the bed stop, and she said she was trying to get into PA school. And I said, well, come to Charlie, come out. And she really has a heart for people. And I'm just just grateful and just overjoyed and elated to see you shine into your purpose. And I can see it, that you're walking into your purpose. And so it's interesting, because we think when one door doesn't open, that the world is going to come to an end. And I remember you said, you can. And I said, Laura, you can. I don't, something good is going to happen to you. So I think it's amazing. And I'm so proud of you, and to see how you've evolved and you found your footing. And not only did you find it, you ran with it, and you're bloomed and you blossomed, and you're awesome at it.
Thank you so much. I'm truly enjoying what I do. Just makes me happy. That's what I live for, and I think that's what your doctor do too. What can you tell us? What are some key principles or guiding principles of functional medicine that you find most important?
The most important that I haven't said already was probably grounding, and I'll reiterate, listening to your body. Our bodies are constantly speaking to us, but sometimes we have to stop and listen. If you have a headache, most people, when you talk to them later on and they've had a catastrophic event, they kind of just keep going and keep going and keep going. Like, yeah, it started off with a headache 3 days ago, and I just kept going because I thought it was this or I thought it was that. But when your body's really trying to tell you something, listen to it. Good, bad, or indifferent, and that's the key. And be in tune. And with the functional medicine, what is like a computer, you're CPU. If you're trying to look for a website, I don't know about you guys, but I forget one little thing in there, or one period, or you're sitting there like, oh my God, I can't find it. I can't find it. And it's something very simple that's right in front of you, and you're like, oh, there's a period there. All right, and then you can find the website. So that's the same thing with your body. When you really tap into that and you listen to it and you give it what it needs, it will give you back it will reward you and give you back what you need to do that litigation, to sit there with those clients, and not only to do it, but do it with grace and do it because that's what you love.
That's amazing. Now, how do you doctors stay up to date with the latest research and advancements in functional and preventative medicine?
Oh, I'm a nerd. Okay.
I know that.
I'm a nerd. So, I have my friends, and matter of fact, this is one dear friend of mine. She's an OBGYN in Houston, and so we usually have a call. And she said, "Oh my God, I'm listening to my new boyfriend, Dave Asprey, and he's talking about and it's trauma." And I'm like, "Oh, okay." And she'll send it to me, and I'll listen to it. And I keep up with going to conferences. Mm-hmm. And I also had a group in Atlanta that I started probably about 8 years ago. Mm-hmm. Because when you go to conferences and you come back, and first of all, you have to take all the information and try to put it in your head, and only like a little bit, stays in. And so I get back to the office and I'm like, okay, I'm going to try this. Oh, that didn't work. Okay, what did I do? So I go back and look at my stuff and it didn't work. So I started the Georgia Integrative Healthcare Coalition. Oh. And we are a group of diverse backgrounds. We not only doctors, we have MDs, PAs, DOs, dentists, naturopaths, health coaches, nutritionists, Pilates instructors, breath work. We have any type of people that are in the alternative realm. Mm-hmm. And we all get together and we have a learning experience. We used to do it once a month prior to COVID. Mm-hmm. We're actually having a meeting coming up the 21st, and we're keeping up on the latest things of, long haulers, COVID, and different things like that, and looking at the various different labs. And we even have the lab companies that we use. They come in and they sponsor. And so we just get together and having that, just that fellowship with your colleagues and learning from them. And then now I have a group of people where I can say, I don't know the answer. Does my group of people have the answer? And then I bring it to them and they just like all this research and and I'm like, oh my God, hold on. I didn't even know. And so that is fun. And I had that up. And so that is amazing. Yeah.
So today I actually went on Instagram to make sure I got your company's name correct. Of course, I had it in my head, but just to confirm. And I saw that my friend Lina Valiukaitė follows you. So she's Lithuanian and she's opening her practice. I think she worked for, don't want to say it wrong, but I want to say she worked for some kind of plastic, or beautification clinics, a surgeon for many, many years. And so excited to see her, opening her own and just going the natural way. She's a beautiful soul. And, I would love for you to, if you don't know each other in person yet, would love for you to connect, so maybe she can offer something in addition, to what you already have in your this, wonderful group of, what is the name again?
Georgia Integrative Healthcare Coalition.
That's it. Yeah. Wonderful.
Yeah, it's a funny story. I'm saying that and I was smiling because I know Lena.
Okay, you do.
We actually worked together.
Oh, okay. Oh, wow.
Years ago. So my background as a PA, I was an ENT. So I remember when Lena first came to the office that she's working at Abrams and facial plastics. Okay. And she would do my face. She's awesome. She's inside out. Yeah. I remember before she got married. I remember when she got married.
Oh, wow. Oh.
And so it was interesting because her and Elisa, there was another young lady that was her front receptionist, all ended up going, at the time I was in my program, and they were all going in research. And I know she went into homeopathy and the facial homeopathy. So she is a great soul. And I already know her. I'm going to be there. I think the open house is October. Something's in October.
Yes, I need to give a call. But yes, I know it's coming up. Yeah, so we'll I'll see you there. Now, doctor, can you share some success stories or patient testimonials that highlight the effectiveness of your approach to functional medicine in improving health outcomes of your patients?
I remember my first functional medicine conference. She is still a patient for me to this day.
Wonderful.
That was in 2012. That tells you how long. And she told me, she said, I will never go anyplace else. And I was wet behind the ears, people. Okay. Wet behind the ears, my friends. And I just applied the principles. As she was on multiple medications for her blood pressure. She was also, one of them, I remember, was a diuretic, and it took an act of God to get her off of those meds. And then she was also being diagnosed with prediabetes. But one of the meds, several of the meds that she was on was actually causing her prediabetes.
Oh.
She couldn't lose weight. She was menopausal, perimenopausal. She felt horrible. And I told her, I said, just stick with me. Just stick with me. Just stick with me. And I want to make sure that people understand this. Natural medicine, preventive medicine, functional medicine is not magic medicine. It's not one and done. You come and you get a pill and you feel better the next day. It takes time. It took your body a long time to get there. It's going to take a longer time to get out. So I want to make sure people understand that, because now I'm getting these patients that come in and they think like, I'm not better than mom. And then they go write a bad review and you're like, you didn't do anything. You know, we were just at the, we were just opening the package. Yeah. We didn't even know what was in there yet. So I want to make sure people understand that. But I'll never forget. And she came back and we got her blood pressure down and no medications. To this day, we took her off. It took about 6 to 8 months. No medication. Now she's lost the weight. She looks amazing. She's too skinny, if you ask me.
Wow. Okay.
And she's getting ready to retire next year. And we kind of go back and forth between our grandkids and things of that nature. But she's just, I know that was another one, that she's not on any medication, diet, lifestyle, and supplements. And her cholesterol was off the roof. We got her cholesterol down. She's doing great, and she's not.
That is amazing story. And I know, doctor, that you have a blood draw lab, because I've done it, with you years ago, and you still have that. And do you recommend, or do you have any supplements available?
Yes, I use an online. COVID kind of changed the way we did medicine, right? So I use an online store that's kind of a e-commerce site for my supplements, and I've kind of vetted all the supplements and using the ones that I try to make them cost effective. And one of the other things I want to bring across too, when you're saying some of the myths of functional medicine, it does cost money, and some of the tests aren't covered by insurance, but you should not be spending a mortgage payment in the labs that you're doing. And if you go in and you're doing 7 labs, or 6 labs, or all these labs, then my question is to some people is like, well, what are you going to treat first? You have to really think. So I look at it from different folks, like which comes first, the chicken or the egg. So I'm going to start phases, and then I do it to the next phase. And then I go to the next phase. Because what I was finding, Laura, is I was coming in and all of my knowledge, all of my education, oh, woman, right? And I look at my patients and they're like, huh? What? Vita who? Vita coffee? What's that? And I'm sure you're like attorneys, when you start doing your gibberish and throwing the language out and the lingo, because when I read these, I totally understand, because when I read these legal forms and I have to fill out, I'm like, what? I don't even know what I just go. Right? So I'm pretty sure it's like that. So, but I have to stop and put myself in the shoes. And one time I had a physician came in and she said, I don't have a clue what she just said.
Interesting.
So if I'm talking this to a physician and she didn't understand it, can you imagine talking to a layperson or a lawyer that has no clue, no background in medicine, didn't understand? So I pull back a lot, and I see you more often, and I get you to, we work in phases. And I had a mentee came in one day and she says, why do patients do whatever you tell them? And I said, because they have to understand. If you understand why you're doing what you're doing, you don't have a problem with doing it. But when you don't understand it, you don't understand why you're taking this. What is this for? That's for, I don't know. You can't follow through. And so, and if you're also overwhelmed, you lose them. So I work in phases. So I wanted to make sure that if you're going to people and you feel overwhelmed, if you're seeing another functional medicine doc and you're feeling overwhelmed, this is your appointment. So you can tell them to slow down, or you can find somebody else that will explain it to you.
And I've heard you, I remember, I've seen you with a few patients, quite a few patients. You just have this calm, very, methodical, easy way of explaining people, regular people like myself, in simple terms, why they're here, why they were recommended by somebody else. And, that's why I guess you are the gut doctor. Is that the correct term the community calls you? Okay. So what are some strategies or recommendations you provide to your patients for maintaining optimal health and preventing future health issues?
Nutrition.
Back to nutrition.
Eating good quality food. And taking care of your mental space. That's important. And spending time with family, doing the things that you love and finding yourself. I'll never forget, I had this one patient and we did all the things, and she was still miserable. And she had some things going on with her life. And I told her that paper, she looked good, but she had a lot of stress. And so I gave her some advice, and all of a sudden, I got a card from her, and she says, I took your advice. And she says, I'm not doing this anymore. I'm not doing that anymore. I'm not doing that anymore. And she finally found what she wanted to do, was to take care of babies, take pictures of babies in the NICU. I mean, in the newborn babies. And she left Georgia because she was miserable. She had moved here with her husband. And when I saw her, she came and gave me a hug before she left. Like night and day. So it was nothing really medical. And that's the thing with functional. You have to be able to identify what's really the problem. Sometimes it's not what we're eating, it's what's eating us. So when you can identify whether it's guilt or whether, grief or any of those things that are ailing a person, and being intuitive. And I thank God that's one of my gifts, is being intuitive. So I hear what you're saying, but I hear what you're saying.
Yes.
So it's like you're saying this, but what you're really saying is a cry for help. And so again, I can identify it. I don't treat it, but I have a village of people that I can send you to, and we communicate, and the person becomes whole.
And you almost, answered this question, but do you have any particular specialty that you are the star of in Georgia and beyond, or something unique about your practice that brings patients only to you?
Well, they call me the gut doctor, okay? And that's how I got my name. And that was because I always start with the gut, and that was drilled in us in naturopathic school. So that is key there. And I start, because inflammation starts there, that's where I start. Also, healing starts there, that's where I start. And the other thing, my daughter has an autoimmune disorder. And when I was open the practice in 2014, she came to me and she told me she was pregnant with my granddaughter. Somewhere around there. And so when she was pregnant, after I opened the practice, I'm like, okay, we're going to check your thyroid. She had some issues, previous teenager anxiety, all this other stuff, and college and stuff. And we went to the doctor, we chalked it off. And then one day she came to me, and she was in college, and she had oral allergy syndrome, where her lips would swell up like a balloon. They feel like they were going to pop. So we chalked it off. I sent it to a friend of mine. He was an allergist, immunologist, and he said, "Oh, it's she's allergic to ibuprofen. Just don't do ibuprofen ever again."
Okay.
I'm like, okay. Had to find out when I checked her labs, and it wasn't until she was pregnant. I checked her labs, and I know the thyroid is very important for development brain of the fetus. She had an autoimmune disorder, but her thyroid numbers were normal, right? So when there was nothing else I could do. So when I figured that out, I'm like, oh my God, this explains all the other stuff that she had going on. So how did we do it? We did it with food. Again, food was a medicine because she was pregnant. I couldn't do anything. And she went into remission. And when she got pregnant the second time, and this is key because she could not do gluten and dairy while we healed her. But when she got pregnant the second time, she could eat gluten and dairy. So it doesn't mean just because you come off of something that's where you're going to be stuck there. So autoimmune is my other in hormone imbalances because I treat people like me. They're in the hormones. It's going to the flash. I read this stuff. It was like, I'm still hot, but it comes in flashes.
I love it. Yeah.
So, in that you can age gracefully. I don't like the thing anti-aging because age is inevitable, but you can age gracefully, and it's just a beautiful thing. And that's really what I focus on. And then I dealt with my own weight issues. So I help people heal weight, I'd say weight release, because when you lose weight, when you lose something, what do? You look for it or there's a void. When you release it, it's gone.
I love the way you put it. Never heard that one before. Yeah. I need to remember it.
And it's so negative self. What do you do? These negative self, the negative talk, these self-sabotage, we're a size 12 and we're like, oh my God, I'm so bad. But somebody of 16 would love to be a size 12, So we have to learn to love our bodies. I have to learn to do that. So a lot of what I do, really practice, has kind of evolved from either healing myself, working with my family, or finding that patient that trusts me enough to want to do those things with me. So the gut health, also hair. I'm now the hair person. I had no idea.
Oh, wow.
But the hair loss. The young lady, she's a wellness blogger, and I've had calls from California. I've had calls from overseas, from India. During the pandemic, all of this, nothing I could do for you. You're in India. And somebody called me from Switzerland, and I was like, because it was there. They were willing to travel. And I'm like,
oh, goodness.
Yeah.
Oh, wow.
So, but it's just, I just love what I do. And I love, seeing people get there. And it was interesting because right before our meeting, I was back there checking my messages. And one of the young ladies that I feel like I'm her mom, she's like 20 something years old. And she would call me all the time. She was always in a flare, always in a flare. And now we checked her messages and she says, I just need a refill on my medicine. Everything is going good. And I don't know if you heard me. I was like, yes.
Okay. Yes, I did hear. Yes, I was wondering where it was. Hallelujah.
I was afraid to open the message because I was like, oh my God, it's a crisis. But I was so excited and so elated to know that she's finally there. And it took a year and a half.
Okay. It's interesting. So what are the most common conditions, illnesses, diseases, or symptoms that patients come to see you for help? Why do they come to you?
I think the biggest thing is, people go that love, like, and trust. So, they'll see on Instagram, they'll see on social media, they may see something that interests them. They'll Google, like, functional medicine doc near me. They'll read the reviews. And then I also have a 15-minute free discovery call with my health coach. And so, who was also a previous patient of mine that now has turned health coach, and now we work together. And so Sharon also shares her story, and she's very, very authentic, not, just a kind, good heart person. And so when people actually make that connection with her, or they make that connection with either something I placed on social media, and then they come to try it out. And then referrals from other people, other doctors, and different things of that nature. And I built up a reputation throughout Metro Atlanta. And it's just, I hope that people can see that I care. I think that's what people say. You listen, you care. And I feel like I was finally heard. And I will try things. I'm not going to do anything that's going to jeopardize my medical license. But if somebody comes and they says, hey, I heard this was this for this and this and that. And I'm like, well, I can look into it. Hopefully I don't have an ego. So people can see that. And I think people just want to be heard, Laura. That's it. They don't want to be shuffled or you're a woman, you're depressed. And the reason you're depressed is because, you're aging and they don't want to give them hormones or even look in that area. And I'll say, no, but that's a concern first. Let's check it out. And then if it's something, I'm like, that's not it. But, we can look at X, Y, and Z and see if there's some other stuff that's going on and we can figure it out. So I think people like that. And like I said, I think it's just the credentials and hopefully.
I love it. By the way, you look actually, the first thing I told you, doctor, is that since I saw you, I don't know, last time or the time before, you look so much younger. Whatever you do, it's working. You're definitely applying your principles to yourself. And this is the best example. That's true, because I know her for many, many, many years. She's looking younger than ever before. So proud of you. So happy.
I'll be 60 this year. So yes.
She looks not a year older than me. Yeah. And she looks actually younger than me. So it's amazing. So what would you say are the most tangible benefits of functional medicine, besides maybe personalized approach or focus of root causes?
The tangible thing for, I think, the patients is when they understand their own body and their entity and their disease, and you educate them with that, and you give them the tool that they can live with, and then they can manage. This is something that's manageable. I can manage it to the best of my ability. And when I can't, I have a co-manager. I have a doctor. I have somebody that's going to co-create with me and that's going to help me through that. And so I think that's the biggest thing for me and the patient. And when I love to see them, where it's almost like, you have a kid, right? And I know Luca is getting up there and it comes to the point where it's like, oh, but you got to go. And when you see them blossom and they really, they heal and the patient gets it and they heal, that's the pinnacle for me.
That's wonderful. Now, do you believe that the functional medicine is suitable for all individuals and all conditions? Why so?
Functional medicine is amazing just for any entity, even for just wellness, because you're bringing awareness to your body. I think I was looking at something the other day and they were talking about, oh, you need Botox. They're talking at the age of 20, right? But functional medicine can even help from infancy because if the mother's having some issues, if the baby's having some food allergies and the mom is breastfeeding and all of that, I work with a functional medicine pediatric group, the Wellness Center. And we work together because
I'm sorry, what is the name of that center?
Wellness Center.
Okay.
And they're right in here in Roswell. Because if the mom's unhealthy or if the baby's unhealthy, the mom's unhealthy. So you have to change the whole household. So yes, functional medicine is great for anybody if you just prevent it or you really have a catastrophic, disease. But understanding it's medicine. We cannot outdo what was, and that's the other thing. People want to come in and can you reverse all this bad habit that I've had for 20 years? No. And yes, at the same time. So we can reverse it to a certain degree, but we can't erase it. Right. So it all depends on the entity. There's a couple, there's a very good friend of mine that had breast cancer. she did nothing but functional medicine.
Mhm.
She did alternative medicine, alternative treatment, and she's doing great now, no issues. My mom had multiple myeloma. We treated her with functional medicine and conventional medicine. Multiple myeloma, the prognosis is usually 6 months to a year.
Mhm.
My mother survived. My mother thrived 13 years with multiple myeloma. She went on her first cruise right after she was diagnosed, and she told the doctor, she says, "Wait a minute, I'm going on a cruise with my high school class reunion. Can I go?" And he said, "Sure." They didn't expect her to probably live. I moved, and then she was fine for 6.5 years. It came back. I moved her here with me to Georgia, and she lived with me. And I walked her into Dr. Jolly's office. I, as well as Dr. Jolly, thought she had 6 months to live. My mother lived 6.5 more years beyond that. So, and one of the things was interesting, even the oncology noticed, every December, my mother would take a turn for the worse. Her numbers would get bad. My dad died in December. It was stress related. It was living in her body. And that's what was one of her stressors. But she thrived. She went on 3 cruises. That woman was like, she's there. She got social life, like drive, like driving Miss Juanita.
I remember your mom, beautiful inside and out, just beautiful, beautiful woman, such a sweet lady. Are there any particular conditions or instances when patient may be better suited to visit a traditional medicine practitioner versus functional medicine practitioner like yourself?
Yes. When you don't want to make change, you need to go ahead and go to your regular doctor. This is all about change. It's a participation sport. It is not a dictator sport. So if you're not ready to make change and be accountable for your own actions, then you do not want to see a functional medicine doctor. The other thing, if you're having, and like I said, we work in tandem with each other. So it's not necessarily, that you should not see a functional medicine doctor. You can see a functional medicine doctor, but I always tell patients you always have to have your primary care because you need that primary care if you have an acute issue or a catastrophic issue, then you need that person. So that would be the only thing. Conditions, like I said, if you're having a heart attack, don't come and see me. Don't call me.
911. 911.
911. If you're having my husband, he delivered George maybe about 1.5 years ago, and that was his kidney stone, right? So I that he had to go and get that removed. So there are certain situations, but again, if you're seeing a functional medicine doc and they tell you they can do all the things for you, be leery, because they can't. It takes the community. Like I said, it takes a community for this.
So when it comes to testing to identify the underlying medical issue, do you use similar methods as the traditional medicine doctors? For instance, drawing blood and using centrifuge, testing skin, performing bodily checkup?
I do. I take it a little bit further. Sometimes if we're looking at urine, you can do hair samples. You can do blood, and you can do saliva. So it depends on what you're looking for. A lot of times mold is a culprit as well, mold toxicity, a heavy metal toxicity, and some of that can be done with some blood, but a lot of it is more than that. And you can do bioenergetic scanning. There's another practice I work in tandem with, and it's longevity, and they're in edge of Roswell, Woodstock. And they use bioscan. And so a lot of times if I have patients and they have limited resources, the bioscan uses energetic to kind of figure out where you're off. And then if it comes up and there's kidney or there's spirochetes and there may be, line or whatever, then I'll go back in and I'll order some more of those tests. So again, like I said, it's nothing all in-house with me. I have a community that we go back and forth and try to get the person on the right track.
Very interesting. Now, it's rather an exception than a rule, and but I met quite a few medical doctors who are also attorneys and apply themselves in both seemingly unrelated fields. What would you recommend to a student of law who is also considering study of medicine, or who is already is a lawyer and would also like to become a medical doctor? Would you recommend them taking the traditional medicine path or that of functional medicine, and why?
Well, it all depends on what you're looking for. As if you're looking, I think a great field of study is functional medicine law. There's not too many people that are doing it.
Oh.
There's one gentleman, he is a functional lawyer, and his wife is a doctor. So by his wife being a doctor, he became the functional lawyer.
How interesting. Okay, that makes sense.
Because not knowing, not knowing the difference in what is okay. And the interesting thing I've always told Scott, I said, Scott, why don't you get an umbrella of people in different states, because he's in Florida.
Huh.
So how do you know how to do Georgia? So the Georgia law, the functional law of that, but it would be great if I had somebody in Georgia that did functional medicine law. So, but if you're doing regular medicine, and you're doing, litigation and different things like that, then you need regular medicine. And there's a dear mentor of mine, another Pam Smith, and she is a doctor, and she does a lot of dissertations and for litigations for people that have malpractice suits.
Okay.
Because you're making sure you're doing those things. So I think it's a great thing. Matter of fact, one of my classmates from PA school is now in law school.
Oh, look at that. So, okay. Yeah, that's amazing. I love it. I love the marriage there.
Yeah, I thought about one time going into that because I thought it would be great, because it's just when you look at law in medicine, it's so great. It's well, you're not supposed to do that, but what does that really mean? So I think it all depends on what you're focused on, but I'm telling you guys, if you're wondering how to do this, functional medicine, you can still go to regular route, but functional medicine law is going to be on the rise. So.
Ooh. And doctor, it's never too late, 60, have you heard? I just made up this term as I'm going right now. The 60 is the new 30. Oh. So it's never too late.
Now, it may not be too late. I have no more punches in my punch card. I just have my thing to do now is I really want to get into corporations.
Okay.
And so the corporations, because I want to reach more people. Medicine is really kind of my thing. And so by getting into corporations and making corporations healthy and happier, and you're getting more productivity. So I just got certified. I'm a certified business coach.
Oh, congratulations.
And so I just did that. And I'm going into corporations. So if your law firm needs some help, call us, okay? But and so going in and just kind of really assessing what's going on health-wise with how you're spending your health dollars, what type of health plans, wellness plans do you have? Do you have a stress reduction? I have a good friend of mine that she has a center. I would love to take you over there one day. It's a stress reduction center. It's non-invasive, and there's different machines through energy that you can kind of get regenerated. It's called revitalize and be energized, and I'll get back on that. Be energized and vitalized. That's it. But it's where I go when I need a pickup and just energized and getting that plugging back in, getting to just being.
Can we go after this today?
Yeah, I know.
Please.
Yeah, but that's really where we're doing is trying to go into corporations, setting up basically wellness or Zen rooms, and where the employees can kind of go and relax. Because in Europe, I grew up in Germany, and it's interesting because they value work and they value age a whole lot different And the productivity is different. My mother had an opportunity in my work when I went back the second time. I was married to the military, and I worked in the German economy. And one of the things that they did when you walked into a place of business, that I don't know how it sound, but if you were 60, I walked in the door with 60 days of vacation because of the age. And if you said you were stressed out, the doctors would write you a 2 weeks, a week off. So you can and you would get paid for it. But one of the other things is people rarely ever abuse that, because they would use it because they would have their productivity would be different. And that's why you're seeing all the Silicon Valley, all these different other corporations, they're becoming more lax and all the different things, because if they make the environment well, then they're going to have well employees, and then they're going to do well. So well plus well equals well.
Absolutely. Double. So it becomes double D, triple D. Coming back to the name of your company, what does exactly 3D Wellness mean? Why there are 3Ds?
3Ds is I have 3 degrees. That was one. And the other, there's 3 degrees of healing, mind, body, and spirit. And then I'm a Christian, so Father, Son, and the Holy Ghost. So that was all of the 3s. And it's so interesting because I do everything in 3s. I take away 3 things, I give you 3, and I'm like, I really am a 3er.
Yes,
I'm a 3er.
I love it. I love this woman, by the way. That's one of the reasons I love her. Is there any type of treatment specifically for attorneys undergoing stress, depression, or anxiety, or even worse, getting lost in alcohol or drug abuse, where functional medicine would be extremely helpful by providing a healing approach that leads to a successful outcome?
Most definitely. Stress. A lot of times we think it's stress in life, and it could be nutrient deficiency. It specifically comes to mind as B12, folic acid, also magnesium. Magnesium is nature's Xanax. It's good for over 325 processes in the body. It helps with sleep. The other thing is making sure you get adequate sleep. If you have sleep apnea, that's another thing. And taking those regular vacations, and it's okay to say no. You know, if something happens to you tomorrow, whatever law firm or even your family, my mom passed, I still had to continue. I still had to live on. And so your life does go on beyond that. So I know a lot of times in high performing professions, we think we have to, if we don't do it, no one's, right? And that's not the way it works. So we have to take that time for that. And the other is hormone. You know, a lot of women with hormonal issues. And the hormones, man, I call them the hormones. You take the horror out of your moans and with the moans. Yeah, because it's just like, oh my God, you feel like your head turning around like the exorcist, and they just like, oh my God. And the women come in here like, oh, thank you, I feel so much better. I was going to kill somebody yesterday. I feel so much better, you know. Hormones, getting your hormones checked. And yes, men, you do go through change of life. We call that andropause. And so your testosterone can be low. And then, you know, just community is great. I love what you're doing here. Community, because a lot of times we think we're on an island and having that community. But that's the biggest thing, is this just doing those hormones, giving your body what it needs, checking to see if there's any heavy metal toxicity. My dad was in the military, the motors and stuff on amalgam filling, so that can be toxic. You know, what are the toxic things? We're getting ready to do a 5-day detox challenge, and just for people to understand what is toxic.
Pick me.
The receipts that you get, the BPA, and you take the receipt and you get all that BPA. You're reading the newspaper, all those things, you know, that you're getting, the ultraviolet, the UV lights and all the other things, LED lights, all that stuff that we're just bombarding our body with. And it's almost like we go to the gym. I mean, we can lift 50, you know, we can bench press 50, right? We don't walk around with 50 pounds extra every day, but we increase our mental load, our toxic load, our inflammatory load, and our spiritual load. And we have to learn to unload all of those.
That is so great. And I hope, my dear listeners and viewers, you've learned as much as I did today about functional medicine in this episode. But please tell me, Dr. Sonza, how do you do things differently than your peers and other, functional medicine practitioners? Why people come to you? And also, how can they find you if, God forbid, somebody gets injured, is stressed out, if they've been going to a regular doctor, nothing had helped, they just totally lost hope? Why would they come to you? And how can they find you, as far as your address, social media, maybe website?
Yes, you can find me at www.3DWellness. The 3 is spelled out. It looks like 3, I know, but it's THREEDWellness.com. My Instagram handle is Dr. Sonza, Sonza Curtis. And Facebook is 3DWellness. And LinkedIn is Dr. Sonza Curtis, I think it is, on LinkedIn. And I'm sorry, the first part of the question.
Why would they come to you versus your others, your colleagues? Yes.
I'll be honest with you. I get up every morning and I pray that I attract those people that I'm supposed to attract. So like this meeting we're having today, me walking in, at the bus stop, meeting Laura, I don't believe there's no coincidental. I think everything is the way it's supposed to be. And I think for those people that I resonate with, they love me, I love them back. And why do they come to me? I listen. I have both sides of the fence. So not only am I training in the traditional world, I'm training in the naturopathic world, and I have functional medicine certification behind me.
Mm-hmm.
So there are people that are just, the PA. Then there's some PAs that do functional medicine. They've got the certification in functional medicine. There's naturopath that has certification in functional medicine. But there's rarely that you have a PA and a naturopath that's certified in functional medicine. So if you're looking for that, read it. There you go again, girls. Everybody, that's so if you have that, so that's one of the reasons why people seek me out, because one, if they're looking for natural treatment and I can write a prescription, and they feel heard.
So next time talking about 3, maybe we can have Lina or somebody else that you would recommend. I would love to have another lady with us on the next episode, because this is something that the attorneys and doctors actually have been asking me to do more episodes, which actually this is our first with Dr. Sonza Curtis, to do more episodes about functional medicine and its impact in everyday life of everybody, really. That is so great, Dr. Sonza. Again, thank you so much for being my very special guest. Love you to death. Truly.
To life.
To life. No, that in a good way. That was said in a good way. And again, being this very special guest on my podcast, it's time for more injury funding. But before we conclude today's episode, as promised, I have a fun pop-up question for you. Ready, doctor?
I don't know.
Tell me, how big is your inner circle?
It's my inner circle. Weesh. Interesting. The closer I get to my purpose and the closer I get to where I'm supposed to be, my inner circle gets smaller. Everybody is not supposed to be in your intimate space. I always thought, because I always wanted to have, oh, come on, we're going to be a big person. If I'm going, you're going.
Mm-hmm.
And I had to learn the hard way that everybody that you love doesn't love you the way that you love them. And it's nothing wrong with them, and there's nothing wrong with you. It's just, that's not what it's supposed to be. And when you realize that, you're fine. So there's no animosity, there's no thing, but it's like certain people I keep, like there's things that's going on with me in my life. And I don't see them all the time. Like when I see you, And I can see people like every day, and I can't share that with them.
Mm-hmm.
And it's not that it's sometimes it can be lonely, because you don't have that. So finding that inner circle is key. I read something the other day, and I don't know if it's Denzel or somebody, and it was saying that, if you're not hanging around, you need to hang around somebody smart. If that's not in your circle, and you need to have a millionaire. So I'm looking for millionaires, guys.
Raise your hands.
So
Raise your hand by putting like on to this episode.
It's like, so that, really defines, who you are, the 5 people you can hang around with. And I love my people to hang around. We get along great and we do all these things. But if you want somebody to take you up to the next level, then you have to close your inner circle.
Mm-hmm. I couldn't agree more with that. And I'm noticing that, in my own life, it's very interesting. I'm in the progress. You're getting there. I love it. Absolutely. It was wonderful time spent with you, Doctor. It again was Dr. Sonza Curtis with 3DWellness, ladies and gentlemen. And again, I want to thank you so much for spending time with me and just sitting here and talking about what we talked. And hopefully we can expand on it in the future. Of course, if you would like to, just let me know. Learning about the functional medicine and its relevance in attorneys' lives today. For more tips and tricks, please follow me at www.moreinjuryfunding.com and also at It's Time for More Injury Funding podcast on all major podcast platforms, including Spotify, Google Podcasts, Apple Podcasts, and all others worldwide. And of course, I'm on all social media, as you know, Instagram, TikTok, Google reviews, and all those good platforms. Thank you so much again, and looking forward to seeing and hearing you all soon. Until then, be well. Thank you.
Thank you.